Hey everyone, welcome back to my channel Dental Cafe. So today we are going to discuss about the implant impression techniques. We have a various impression techniques in the implant. In this video we are going to discuss about the various types of techniques, their pros and the cons. Okay, then let's begin the video. And if you want to know about the implant components and its related video, I'll share the link. Basically, we have three types of technique for implant impression. First one we have closed tray, also called indirect technique, and the second one we have open tray, also called direct impression technique. In indirect impression technique, impression coping remain attached to the implant during the impression. And if you want to know about the impression coping or implant components, I have already posted a video. I'll share the link. As you can see in the video, this is closed tray impression coping which remain attached to the patient mouth after removal of the impression. Then we'll remove the impression coping from the patient mouth and transfer it to the impression and pour the cast. And why is this is called indirect technique? Because we are not picking the coping along with the impression. We have to reinsert the coping after removal of the impression. That is why it is called indirect technique. Now second one we have a direct or the open tray. In this, impression coping which is attached to the implant is picked up during the impression. As you can see in the figure, all the impression coping are picked up with the impression. And that is why it is called direct technique, because we have to pick up the coping along with the impression. In direct technique, there is no need of reinsertion of coping. And you guys also heard about the abutment level and implant level impression technique. What is this? It is nothing but if we are picking the coping along with the impression as in direct technique, it is called implant level impression technique, and closed technique is called abutment level because coping is not picked up along with the impression. Now the third technique is digital impression techniques, most commonly used nowadays. This technique uses intraoral scanner to capture a digital scan of the implant and the surrounding tissue. What is the digital scan? Look at the figure. This is we have a scan body. We have to attach it to the implant, and then with the help of a scanner we are going to scan the implant and the surrounding tissue. And then this scan data is used to create a digital model for prosthetic fabrication. In detail about all the technique, I'll tell you in the later video. Why a digital impression technique is popular nowadays? Because of the various advantages, like it reduces trigger time, because there is no need of taking impression. You just have to put the scan body over the implant and scan that area. Improve patient comfort. There is no need to deal with the impression material. Most of the patients are not comfortable with the impression material. And hence accuracy. Digital impression represent accurate uh, presentation of implant and the surrounding structure, and that is why it will provide a better fitting prosthesis. It reduces the risk of errors, as in the impression material there are chances of shrinkage, distortion. It reduces that risk also, and reduces the need for impression material. As you can see in the image, no need of impression material, just scan the scan body. Open tray impression technique, pros and cons. First, what are the pros? It is more accurate. Why accurate? Because we are picking the coping along with the impression. There is no need of reinsertion of coping, and this technique is especially used for multiple implants because it minimizes the distortion as we picked up the coping with the impression, not like the closed tray technique. What are the cons of the direct impression technique? Requires more chair time because you have to place each and every coping very carefully, and then we have to pick up with the impression, so it will take a time. More challenging with the limiting access. If you have a limiting access basically in the posterior region of the mouth because of the long handle of the coping. If you want to know about the open tray or closed tray coping, how they look like, I'll already share a video related to component of the implant. I'll share the link at the end of the video. You can go there and watch. Now, close tray and indirect impression technique, pros and cons. Pros: simpler and faster technique, preferred for the single implant due to inaccuracy in repositioning the coping. That is why they are not preferred for the multiple implants. In full mouth cases, we preferred direct or open to impression technique, and cases with good access. What are the cons? Less accurate and cannot be used for multiple implants because we have to reposition the coping. Now, impression material used for the impression of the implants. There are various impression material available based on the rigidity, tear strength, and dimensional stability. So basically, we are using silicone impression material for the implant impression. We have four types of silicone material. Among them, polyether and polyvinyl siloxane is the material of choice. And polyether we are basically used for the open tray technique, and polyether, polyvinyl siloxane both can be used for closed tray technique. This is very important chart. You have to know about the impression material used for implant impression. And if you want to ask anything related to implant, you can comment on comment section. I'll definitely answer. If this video is helpful for you, then don't forget to like, share and subscribe my YouTube channel and hit the bell icon for the latest update.